No, I loved it. That was also wonderful. Um, I would love to open up the floor to questions, and I think we already have a question that I think actually Alyssa may be best suited for. In the Q&A, it says, I have to get 2 fibroids removed. They are still working on scheduling. Would starting pelvic floor physical therapy before the surgeries be helpful?
Yeah, great question. And yes, so we treat people that have fibroids or PCOS or endometriosis, all things that Jamie mentioned. And I mean, so we can't get rid of those things, but we can manage what is happening because of them. So commonly with fibroids, the body doesn't like them, so the area will kind of start to create tension of the muscles. It can cause a lot of pelvic tension or abdominal tension, and so we can manage that, and that can really help reduce the symptoms that you get. Usually, really painful. Um, if you're still having a regular cycle, that could be really painful periods, and we can help manage symptoms during that. Also, I just lost my train of thought. If you are getting them removed, even going back again, you're going to have maybe a hysterectomy, or if you're just having them removed by themselves, it's the same idea. Like the stronger you go in during that, the stronger you're going to come out. If you can learn um, abdominal bracing techniques, ways of decreasing stress to your abdominals, and you're getting something like a hysterectomy, it's going to be huge to learn, ways to get in and out of bed, breathing techniques so that you're not increasing stress to the area, even like scar treatments. We teach all of those things to help you prepare for the surgery that you're having, and also hopefully like manage pain up until you can get those removed.
Awesome. Thank you so much.
Yeah.
The next question is, at what point should someone seek help? And I'll give my answer, and then Alyssa, you're welcome to give yours. I'm going to amplify it. Um, so in my opinion, when should someone seek help? So when it comes to um, pelvic pain, I think that if you have pain with intercourse, um, any pain with intercourse that's consistent, so meaning if it's just one time and it was a very unusual incident, but otherwise it's great, you don't need to seek help. But if it is more common than not that you have pain with intercourse, you should absolutely seek an evaluation from your OBGYN and consider physical therapy for your pelvic floor. Um, if you are on the fertility journey, if you are younger than 35 and you've been trying to get pregnant for 12 months, you should absolutely see a reproductive endocrinology and infertility specialist like myself. Um, and we will certainly assess about if you have pelvic pain at that time and refer you to PT. If you are older than 35, I'd want you to try to conceive on your own for 6 months, and if not pregnant, see an REI like me and get help. If you have pelvic pain, if you have just general pelvic pain, I want you to see an OBGYN and consider PT because you may have something like endometriosis if the pain is associated with your periods. Periods can have mild cramping, but severe cramping is not normal, and it's usually endometriosis, and I want you to get evaluated. Um, Other reasons to get evaluated would be if you're having irregular menstrual cycles when your periods are greater than 35 days apart. I'd want you to see an OBGYN about that. I think also, like, when should you seek help? I think all of us should seek help right now. It doesn't have to necessarily be with a specialist. It can be reading. It can be enriching ourselves with a meditation practice. It can be seeing a therapist. But I think all of us have a better life experience by reconnecting and coming home to our bodies. And so I encourage all of us to do that every day. Um, Anything you want to add, Alyssa?
Yeah, I love all of what you're talking about as far as like periods. I think that is something that is not really, we're not really educated as well as we should be. Growing up, at least I know like my sex ed class, we did not really learn about what is normal and what is not. And I think women are always a little bit gaslit during things like whether they're, on their period or they're, pregnant or they're going through menopause. It's always like, oh, it's the hormones, it's totally normal, like that's to be expected. But knowing the norms for periods is so really important to know. So exactly what she touched up on, questions that I directly ask to kind of gauge people, just because a lot of times people think it's normal. I'll be like, oh, how are your periods? And they're like, oh, um, the usual, like normal. And then I'll dive in and say, okay, how many days do you bleed? And so if that's more than like, for sure more than 10, that's concerning. But really, I would say like more than 8 is a little bit abnormal. If the bleeding is heavy enough that you're changing a super tampon or a large pad, or even like the period panties, if you're changing them hourly, or still leaking through and you're wearing a tampon and a pad, you're worried about ruining clothes all the time, that's abnormal. Exactly what Jamie touched up on as far as like pain, it shouldn't be super painful, maybe like one ibuprofen or 2 during your whole entire cycle, not like 2 daily or 2 every 4 hours. If you're having to call into work, or like unable to play in your basketball game, whatever the case may be, that's not normal. And so if you're experiencing any of those symptoms and you're like, wow, I actually didn't realize that's not how it's supposed to be, I would highly recommend going to see somebody like Jamie or your OB and kind of getting checked out by your primary care, even anybody, to kind of get some further testing, because that isn't normal. And then going back to, at least for like pelvic floor physical therapy, when should someone seek help? Anytime you're having any type of dysfunction as far as bowels, bladder, period, or sex goes, that is when you come to see somebody like me. So as far as like bowels, constipation or super painful bowel movements, or feeling like you can't control your bowel movements, you're having some accidents, that can be helped with pelvic floor physical therapy. Urinary symptoms, so like urinary leakage, maybe you cough or you sneeze or you can't hold for very long, you're going super frequently, you can come see me. We already kind of talked about like painful sex or painful orgasm, or any pelvic pain in general in that pelvic girdle area that I was talking about. Pain isn't normal. So if you're having it pretty constantly, I would highly recommend going to see someone. And sometimes all of those are related. So you might be like, wow, I have like 5 of those. And it might just be because of muscle tension that's causing all of those things. So yeah, and if not, we can definitely rule out that it's not muscular. And then maybe that's when you need to go checked up and see if it's GI related or something like that.
Awesome. Thank you so much. Let's see. The next one is, what non-hormonal approaches or lifestyle changes can positively impact fertility and pelvic health? I love that. I love natural things that we can do in our daily life. So I recommend a Mediterranean diet for people trying to get pregnant. It's also very good for your overall health and well-being. But feel free to Google a Mediterranean diet. Really, it's fish, green leafy vegetables, fruits, legumes, nuts, that sort of thing. And avoiding red meat is ideal. Abstaining from alcohol. I know in our society, alcohol's been touted as an okay thing, but it truly is a poison. It ages you prematurely. It probably has a negative impact on eggs. It's certainly not safe in pregnancy. So I would cut alcohol out. Of course, also abstain from other substance use, like marijuana use is not good for eggs or sperm. I encourage you to connect with your body, and how you feel in your body with your current weight, because we certainly know that being a healthy weight reduces the risk of infertility, reduces the risk of things like miscarriage and other problems in pregnancy, like high blood pressure, diabetes, preeclampsia, C-section, things like that. So that would be a lifestyle modification I recommend. I think we should all be trying to get 10,000 steps a day. I have my little step tracker that's so good for our longevity and for our fertility and pelvic health. Weightlifting is so good for us as women. It increases our basal metabolic rate. The more muscle you have, the more calories you burn or rest. It helps us feel strong and healthy in our bodies. So weightlifting with heavy weights is what I recommend. Good hydration, absolutely being on a prenatal vitamin. Other things for women when we're older that would be helpful for fertility. So by older, I mean like 35 or older. I'd recommend CoQ10, which is an antioxidant supplement, 600 milligrams a day, may help with egg quality. And just common sense things trying to live a healthy life are my main natural things. You can also do Well, what I recommend actually is ovulation tracking. So if you're trying to get pregnant, using an ovulation predictor kit, having a diary or an app that tracks your menstrual cycle interval, the time from when one period starts to when the next one starts, so you can predict your fertile window. Daily and every other day intercourse have the same chance of pregnancy, so choose what reduces your stress most. Um, and really, when it comes to stress and fertility, I think stress is unavoidable in life. Stress is a part of life. It's where we can have a lot of growth. I think the important thing is to use this time to improve our stress management techniques instead of getting trapped in the sense that we can eradicate stress from our life, because we cannot. It's going to be present no matter what. But what we can do is improve on how we meet that stress and how we manage it. And so things like mental health therapists, meditation, journaling, walking outside in nature every day, learning something new is so good every day. And that's what I recommend.
Yeah, just to add to that, I like to talk a lot about breath. There's so much connection with the pelvic floor. And so just everyday things that you could do that can help pelvic floor is making sure that you are breathing. It sounds silly, but we tend to hold our breath, especially when we learn new things, or especially when we're doing something difficult, we tend to hold our breath. So just kind of checking in with that throughout the day. When you're getting in and out of bed, are you holding your breath and kind of like Frankenstein rising? That's putting a lot of pressure on your tummy, a lot of pressure on your pelvic floor. When you're lifting something heavy, are you holding your breath? Because once again, that's a lot of pressure going downward. So if you're looking for something just like every day that could be super simple, is when you try to lift something heavy or you get up off of the couch, like exhale as you do it. Long story short, this gets like a little pelvic floor lift. It also gets a little bit of a contraction of the core. You think of, you like blow candles, you can feel the core contract. So that's just something small that you can kind of focus on, versus when you're doing repetitive lifting or repetitive getting out of bed over and over again and adding pressure to the pelvic floor and the abs, that can weaken them or just cause more damage there. So that's just kind of an easy daily thing that you can add in addition to all the things that you listed.
Awesome. Thank you so much. So this one, I'd love your thoughts on this, Alyssa. Is there a too soon to see a pelvic floor physical therapist during the first trimester? That's a great question. So if this couple may be only a few weeks pregnant. Anatomically, it's good to know in the first trimester, our uterus, our growing uterus, is still very much protected by the bony pelvis. And so I know that, for example, massage, people may be afraid of massage in the first trimester, but it's actually quite safe because your uterus is truly protected in this bony pelvis. So what are your thoughts, Alyssa, about PT, pelvic floor PT in the first trimester?
Yeah, so I believe there is no such thing as too soon. We usually don't do like an internal pelvic assessment during the first trimester. Not that there is any type of like harm that happens during that, but there's just so much going on during the first trimester. It's more of like a protection for us. But pretty much that's the only thing that we don't do is like the internal treatment during first trimester, but second trimester we can. And once again, it's just a ton of educational things. And when you're only a few weeks pregnant, it's great to learn habits that are going to help you when you're, 35 weeks pregnant and having to like change your posture more. Now it's more important to focus on the breathing, getting in and out of bed. So we can kind of like start you off with learning habits before it's like crucial to know that habit, if that makes sense. So a lot of like preventative treatment and just education. Once again, just looking to see, just because you're not having any type of symptoms, we can look and check out the way you're moving and kind of see some things and be like, oh, I'm glad this isn't hurting you, but let's get after this before it starts to be a bigger issue. Hopefully that
Awesome.
answers your
Yeah, no,
question.
that's perfect. I agree with that. That's great. So the next question is, I have pelvic misalignment. Would chiropractic care be okay, or can pelvic floor PT be more beneficial? What are your thoughts, Alyssa?
Yeah, so I definitely think there's a place for both. I would say if you have been going to the chiropractor over and over and over again and it doesn't seem like it's getting better, maybe there is something that's pulling the pelvis out of alignment that is like not being addressed. So, chiropractors are great at putting you back in alignment. But if they're not kind of finding out like why that's happening, then it might just continue to happen. We have so many muscles that are attaching to the pelvis. So, what this person usually means is the pelvis can kind of get off balance and maybe like offset. Um, it's not like dislocated or anything like that, but it can, you can imagine if this is a little bit off, that's going to affect the muscle or the joint back here. It could also affect the pubic symphysis right here. But there's so many muscles. There's the pelvic floor here, there's the back, there's the core. There might just be tension or a way that you're compensating that's like pulling on one part of it and it's causing it to be out of alignment. Another thing is maybe you tend to, we all kind of favor a certain side, you know, maybe we hold our purse or our backpack on one side or our child on one side. We sit on one side of the couch. Doing that over and over and over again just kind of relaxes one side and contracts the other. So sometimes it's just a matter of paying attention to that. And you're like, oh my gosh, I always sit, you know, leaning like this. It's not so much that you have to sit like this all the time, but now maybe every other night lean on this side of the couch. And maybe that's what could be affecting the pelvic alignment. But I think there's a place for both for sure.
Yeah, I agree with that with both. And seeing what works for you, I think is important. And again, trusting yourself in that process. And I think it's also great to get established with someone with care. So some of these other questions are about when to get established. And I think it's important to, if you're having issues related to your pelvic floor and fertility, I would reach out to a provider, establish that connection so that you can work on preventative things to improve your future. And if something problematic happens along the way, you already have that connection and that relationship. You're an established patient, and so it's much quicker to get care versus being on a wait list to become a new patient. So the next question is, which kind of touches on this, if one is already pregnant and worried about pelvic floor dysfunction that could impact delivery and postpartum, what would be the optimal amount of time to do pelvic floor therapy prior to the due date, or could postpartum therapy be helpful enough? This is so great. So my feeling on this is that probably, you know, late in your second trimester, if you're trying to just kind of get the biggest bang for your buck, so to speak, of your time. So kind of like around 28 weeks of pregnancy, if you're not having issues before then, would be ideal. If you have concerns, so if you have predisposing risk factors, if you've had a previous pregnancy that you had these problems with delivery or postpartum, I'd actually get established even sooner. So like Alyssa said, I'd be working on that even before you got pregnant to go strong into pregnancy so that you can be strong during and afterward as well. I think that, you know, life is hard too, and so I want you to give yourselves grace. I think that we all do our best, and so it would be great to get connected, but if your life is hectic and you just can't make it happen during pregnancy, that's okay. Give yourself grace for that. It's also okay to come when you're in trouble and you need help, and I know we'd both be happy to help you with that.
Yeah, I definitely agree with that. I always try to meet my patients where they're at. There's also so many different aspects that contribute to the frequency. You know, there's insurance issues, there's financial, if you're not going through insurance, you're doing cash pay or commuting to the clinic. There's just so many things that go into it. I usually tell my patients, like, I'll meet you where you're at. Like, I would love to see you. You know, if you're not having any symptoms, I have some patients that I'll see like every 3 weeks and we're like checking in, like, okay, still okay. We want to keep for 3 weeks. And then as they hit the second trimester, doing more like every other week. And then we can always kind of adjust if they don't need it, but it's harder to try to fit you in if you do need it. And oh yeah, going back to kind of meeting you where you're at, there's also, you know, we should be giving you homework and things to do at home so that, you know, if you do live an hour away and it's really hard for you to get here and it just like increases stress, you know, you're also maybe taking care of family members or just have other stuff going on. You're also doing fertility treatments. Then I don't want to increase stress and be like, you need to be here twice a week. Otherwise, this isn't going to get better. There's plenty to work on your own. And if you are really consistent and, you know, are honest with your PT too on like, okay, I have time for like I have 15 minutes. Like, what should I do? That's great. We'll give you information on like what you could do and like each day and all of that so that you can manage it at home as well. I know people hate the it depends answer, but it really does depend. I would always say like in a perfect world, I think like twice a week is always great, but obviously some people's insurances don't allow that. And a little bit is better than nothing. So also spreading it out is great. It's never too soon to come. And then a lot of places I know have wait lists too. So if you're worried about having pelvic floor issues, but they're not there, I would try to get a referral from your doctor. Or if you're interested in cash pay, look for a cash pay clinic. And they likely have a wait list. So, just scheduling something and it might be 5 weeks out. And then you'll have that assessment and you can, if anything has popped up, then that's great. You can get it treated right then. And then if nothing has popped up, that's even better. And you can start to prevent something from happening.
Yeah. What I can sense from both of us, Alyssa, is that we both love education and love helping women. And so I think that it's really important to understand that even one visit with a provider that cares about you is incredibly meaningful. And we can learn things together that can empower you on your journey, even if you just come out one time. One of the other questions, I think the last question actually, is what are the recommendations for women with scoliosis and the impact on pelvic pain during pregnancy? And I have learned during this time with Alyssa that it's really, when you have scoliosis, I would recommend getting into PT before you're planning pregnancy, like just for your overall well-being and strength. What would you add to that, Alyssa?
Yeah, that's exactly what I was going to hit on. If you already know that you kind of have something that could be affected during pregnancy, especially if sometimes people have scoliosis, they don't have any pain or issues. But if you're having pain, would definitely try to get in beforehand. As far as the impact scoliosis could have on the pregnancy, is kind of a tough question, but pregnancy doesn't usually make things better. I don't know if that's a bad thing to say,
That's so
but
great. That's so great.
if you have back pain, it doesn't usually go away during pregnancy. So just things that we highly recommend are like belly bands, proper ones that can help relieve pressure, but think like weight is going to be gained, more weight is going to be moving forward, which is putting more pressure on the back. So it's just kind of trying to prevent anything prior to pregnancy is the best. If you were unable to go to PT beforehand, totally fine. Better late than never. And going to PT can be helpful in stretching muscles, strengthening the back, and doing it in a way where we're kind of manipulating the scoliosis to try to be in alignment. Kind of tough to explain, but there's different ways that we can move the body to try to strengthen in the proper alignment, even though I know that there is a curve. I don't know if that answered the question either.
That's perfect. Thank you so much. Any other questions for us today? We've so much enjoyed getting to talk to you today. I really appreciate your time and your attention. Any other questions before we conclude? I think that may be it. Alyssa, it's such a pleasure. This was our first time meeting virtually this way, and I've learned a lot from you. I really appreciate your time. And thank you to each and every one of you. I just want to leave you with a message of empowerment, an invitation to come home to yourself, to know that you are sovereign in your life, and this is your journey. This is your story. We'd love to help you on your journey.
Yeah, thank you so much for having me. And one thing that I just thought of, it's okay if you do end up waiting. And, sometimes I have patients that come in and they're 38 weeks pregnant and they're like, I know I'm late, but like, what should I do? And totally fine. There's so much education we can give. And like, there's people that want to help you. So even if you're like, oh, I'm too late, I'm already third trimester or whatever, it's never too late. It's never too early. All you can do is like what you can do. So, yeah, you're doing great.
It's so great. The last question was, they say, how do we get in touch with you for an appointment?
Oh, this is so nice. Okay. So I work at Rehab United, in the Kearney Mesa location. Um, and so that's how you would get in touch with me personally. As far as like pelvic floor in general. Is this only open to like San Diego people? I don't know. Is this
No,
like
I think no, it's open to everybody.
nationwide? Okay. You can definitely like I Google pelvic floor physical therapy, do a little bit of research on the therapists that are there and see kind of what they offer. And yeah, we're everywhere, but also kind of hard to find at the same time. So I totally understand. As far as me directly, like I said, Rehab United in Kearney Mesa is where I am
Yay. I feel so united with you in helping women. So everyone remember Rehab United.
at.
Because it is really important to find a provider who specializes in the pelvic floor when that is something that we want to focus on and improve and feel safe with and empowered with. And so if you are Googling, I want you to make sure you find a provider who specializes in that to give you the best care. Oh, and then the final question was for me, where am I at? So I'm at Reproductive Partners Fertility Center. You can find us on Google too. I'm here in La Jolla, right next to the UCSD building. And I'd absolutely love to help you on your fertility journey and help you through recurrent pregnancy loss too, if you ever have to face that struggle. It's been so wonderful spending time together. Thank you all so much. And I just hope you have a beautiful evening and go do some wellness practices to reconnect with your body, come home to yourself and feel safe and grounded and centered with your breath connected to your pelvis. Perfect.
Thank you so much, Jamie.
Hi, thank you, Alyssa.